curling up, writhing in bed, or his family might actually come out and say, look, I think he needs a little something else. So yeah, definitely PRN, breakthrough. Okay, what about the leg? So we talked about a leg dressing, yeah?
Is that going to come under wounds?
So yeah, wound care. Oh, wound care, good. The syringe driver might also come under wound care because he's got a device in. So again, yeah, checking the site, is it in date, is it red, painful, swollen? Good. What about incontinence?
Personal hygiene.
Yeah, personal hygiene. So this would,
And urine. But you're probably not measuring that now.
no, but sometimes you want to know if like,
If he's already got it.
yeah, because then you can tell like if he's stopped weeing completely, especially this heart failure guy, you know like oh, his kidneys are done. That you might, if he's incontinent, you might also be aware of, okay, I might need to wash him a bit more, might need to spray something nice in the room if it's a bit smelly so that it's a bit more of a nice environment. Mobility. So he's still awake, he's still conscious and talking. He can move using a facet that you discussed. Would you try and encourage him to mobilise?
Not if he doesn't want.
Not if he doesn't want to. If he's having a lot of pain laying in bed, and you've repositioned him, you've done everything he wants, maybe going for a walk might be a good thing, but only like really, if he really doesn't want to, or if his pain is really bad, you might be like, okay, let's change position, let's go for a walk to the toilet. Maybe have a shower. It might make your pain feel better, help with the incontinence too, etc. So there are, even though they are in certain like little holes in there, or categories, some of them overlap as well. So that's our mobility. What about family? What do you think interventions you might think about? So this comes under the psychosocial bracket in your care plan most of the time. So if you've seen nurses' notes or you've written notes, in your psychosocial, you'll often see nurses write family present, no visitors, whatever it might be. But like we talked about before, in this kind of patient especially, it might go a bit beyond that. You know, yes, the family's present, which is really good, and they bring him food that he likes. Is he depressed? Like, does he have a really low mood when his family leaves? Because they're not there all the time. Does he need, you know, maybe do you need to spend a bit more time sitting with him, talking to him about something that he likes, keeping him company? If people know they're dying, it's usually, you know, even if they've come to terms with it, it can be a very scary process, especially when their family's not there. You know, they might feel all well and good when the family's there because they're like, oh, I've got someone here. But at night time, you know, when the family leaves, this person might just be laying in bed because they might not be able to get out, they might be in too much pain, and they just are there with their thoughts. Have you ever not been able to sleep and like your mind races? Mm-hmm. Imagine being stuck in a bed, knowing